morning. My name is Maria Velayos. I am a resident of Pediatric Surgery at La Paz Hospital in Madrid. First of all, thank you for the opportunity to present our work here. I am going to talk about our initial training model in microsurgery in wistar rats. The preparation of surgical specialists is complicated and increasingly difficult due to change in the learning model, change in the distribution of caseload, the new technologies, and change in the residency. Therefore, in many cases, they are forced to look for ways to complement it with other learning methods such as experimental models, which are a tool for the acquisition of technical skills such as sensitivity, precision, and command in surgical movements. But one of the big problems is the lack of standardization. The objectives of our work were to show our initial model-based training in microsurgery to serve as a model or guide for others and analyze the learning curve during the process, including the operative times and the functional outcome of the procedure. Our experimentation program is composed of an initial theoretical part and several practical modules divided into three levels. First, basic mode that includes the activity in non-living material. Second, transition mode in cryopreserved artery. And finally, experimentation mode with live animals, in this case with the rats. We decided to focus on describing and analyzing the experimental modeling with the rats. The sessions were carried out in December 2021 in a room of an experimental laboratory with microscope and microsurgical material. By December residents on wistar rats where the 66% were male with mean weight of 400 grams. A series of basic procedures were selected: tile-vein cannulation, valorization and anastomosis, dissection, section and anastomosis of cava and aorta. The surgical time and functional outcome was measured in all of them. A total of 9 sessions were carried out. The mean time of the procedure is shown in the upper part of the table, and in the lower part we watch the functional result, where 100% of the tail cannulation and bowel anastomosis were successful, compared to 89% of the aortic anastomosis and 66% of the cava anastomosis. This procedure is the most difficult. These facts were reinforced when observing how the times were shortened from the third attempts onwards, except for the cava anastomosis, which was similar to the 9 sessions. So we interpreted that this was the most difficult to obtain functional success and improve the times. In conclusion, the proposed training model showed that the products were adequate for the training's progression. The creation and continued development of training core protocols on live experimental animals will improve the technique. Microsurgical training will benefit from the standardized programs to optimize outcomes and adhere to the 3 principles. At the bottom of the slide, you can see code that will take you to videos about the techniques. Thank you so much.